So people often come in and say, I'm worried about this lesion, but it hasn't been causing any pain, so it's probably okay. But during these early stages, it will often not cause any symptoms at all. So it's still very important to get them checked, because pain is not a good indicator that something is cancerous. So with skin cancer, people are usually only worried about melanoma. That's what they hear about in the news and read about in the magazines. Unfortunately, BCCs and SCCs can still spread to other parts of the body and still kill patients, with the current numbers being about 700 a year alone in Australia. So it's still important to get these other types of skin cancers like BCCs and SCCs treated early, because if left alone, they do still spread to other parts of the body. So symptoms can happen at various stages throughout the skin cancer. Sometimes in BCCs, for example, a symptom we might see is bleeding, because it has lots of tiny blood vessels just at the top of the lesion, and those are very fragile, and when brushed up against by clothing or towels can cause bleeding. But we can get more aggressive BCCs that have no symptoms at all. So it's a very variable sign and not a good indicator if something is aggressive or not. Patients will ask, what does a skin cancer look like? And they can look like lots of different things, and often people will only be checking for dark and large lesions. But in fact, most of the skin cancers we cut out are actually BCCs and SCCs, which can often look like red spots or pimples or blisters that just never heal, sometimes even just a red patch that doesn't go away. So often it can be hard to work out what it looks like, and any of these lesions, I normally say if it's lasting more than 6 weeks, then we should definitely have a look at it, because if it's something like an insect bite or an irritation, they should have healed by that stage. On top of these sort of visual things to look out for, sometimes we'll have other sort of symptoms like pain or irritation of these sites, and those are valid reasons to get these spots checked as well, because when we catch these cancers very early, it's not a big deal to get them managed. Those sort of things are very suspicious for us as a potential squamous cell carcinoma. A lot of people do think the melanomas are large, black, and very angry looking, and that's certainly what we see on news articles, posters, magazines. In fact, most of the melanomas we cut out are not actually the darkest or largest lesion on the body, and that's what we spend years of our skin cancer training doing, picking up melanomas when they're at their smaller stage, even 2 millimeters in size. When they're at that size, we have to magnify them a lot with a dermatoscope to find these subtle features of a melanoma. And whilst we pick up many melanomas every week, most of them are in their very early stages because of this.